Zimbabwe's COVID-19 infections now stand at 51, with recoveries still at 18. To shed more light on the new cases, we are joined as usual by the COVID-19 Chief Coordinator in the Office of the President and Cabinet, Dr. Agnes Mahomva. And as the coronavirus pandemic rapidly sweeps across the world, it is inducing a considerable degree of fear and worry and concern in the population at length. And that is why today we have invited a psychologist, Dr. Chirisa, who is also the Zimbabwe Medical Association, ZIMA Secretary General. Good morning and welcome to Good Morning Zimbabwe.
Thank you.
Doc, maybe you can just start by giving us more details on the new cases that we have right now.
Thank you very much. Yesterday we had a total of 3 new cases, and 2 of them were returning residents from Botswana. One is a Harare resident. So we continue having the large number of cases that are confirmed actually coming from outside Zimbabwe, and that really puts that spotlight to that risk group. We have said we need to focus more on those risk group areas like the returning residents, crowded places, and so on and so on. And it really confirms that we need to do more in that area.
I also noted that the other third case is also the person has got no history of travel whatsoever. What does this mean? We're now looking at communal transfers. What does this mean for us?
I wouldn't rush to say that. When we identify a case, we then go out and take more history, go out and look for contacts, trace them, and begin to try and figure out, is it really just local, or are they linked to another case that we identified earlier? I think at the moment, Zimbabwe, we're still really looking at those cases that are actually coming from outside more than anything else. We are saying to ourselves, as we move with all the preparedness that we have done, let's now focus on those risk areas, for example. In line with the global guidance and scientific experts out there, it is very prudent for Zimbabwe at this point to look at just 6 criteria that we need to look and say, are we really prepared? Can we continue to open up our country, as it were, as has been actually articulated by the President, that in the next 14 days we need to look at the achievements or lack of and so on. So we are pushing and saying, let's use this criterion which looks at transmission. If we're having cases coming out from out there, are they passing it on to other people? Are they transmitting it, or is it confined because of our quarantine facilities? If we're looking at our health systems, are we ready? Are we able to identify suspected cases, test them, isolate, care for them, and to contact trace? That's point number 2. If we look at point number 3, the hotspots, I have emphasized the hotspots. What are we doing about churches, the marketplaces? Have we managed to put in place measures to prevent and so on? Point number 4, the schools. There is a hot debate now. What should we do about the schools? And of course, not to forget about the economic activities of the country. Are we ready to make sure that the workplaces out there and so on, have we put in place the measures that are required to do that? And of course, we're really saying, if we are saying we're ready or we are almost there, what are we doing about those imported cases? That's a big risk area that we're looking at, working flat out to make sure the quarantine facilities are there and so on. And finally, point number 6 that we all should never forget, the communities themselves. Have we educated them enough? Are they empowered? Are we engaging them? We can do all those things. And yes, as we're speaking here, we're giving information to the communities. But they now need to come in and make sure they're actually doing something for themselves, demanding for the services, demanding that your neighbor should wear a mask, and all those things. So there are 6 criteria that we're now really focusing on, saying, let's move and strengthen our preparedness and response.
Coming to you, Dr. Chirisa, from the 18th to the 24th of May, it's Mental Health Awareness Week. And the theme for this year, apparently, it's kindness. What is the main psychological impact of the COVID-19 on patients, caregivers, health workers, as well as the family?
Thank you so much for that question. What we have noticed, and being a psychiatrist, is that COVID has affected how people think. It has affected the normal routine of everybody in the population, from the highest to the lowest. And what we have seen is that there is a lot of anxiety, fear-driven psychological behavior, which is expected when in a pandemic like this. I actually say that if you are not fearful, you really need to also to be seen. We are actually concerned because it is this fear which is expected when such a pandemic breaks out at such scale, which has never been seen since World War II or something like that. So there is a lot of fear, there's a lot of depression, there's a lot of obsessive compulsive disorder that we are seeing. There are effects in families. There are, increase in gender-based violence, increase in child abuse, especially now that kids are not going at school. The parents are frustrated. The lack of money, we call that community psychiatry, where a mental health function of a person is dependent on security, on health, on shelter, on food, and all those things have been threatened by the COVID. So that's why you see that we are expecting a pandemic on its own to form, or is forming as we are going, of mental health disorders.
Okay, so does the country have any supportive infrastructure for psychological support in a case like this?
One thing, we were not prepared for this level of magnitude of mental health. But what we have done as ministry, being the deputy director there, is that we have organized the resources that we have in country. At the moment, we are using the resources that we have in country. We've organized massive trainings which are already ongoing on virtual, where we are training people and cadres in all provinces. We have, since last year, put in provincial mental health officers in all the provinces, and those are the ones that are manning each province. So each province has got a mental health officer who is controlling and organizing even all the psychosocial support in quarantine, in hospitals, and in all the districts under that. So we've said, look, what do we have on the ground? We've actually called in for volunteers. So we've called in psychologists, counselors. We've even called in pastors and church leaders. But what we have done as ministry is that we are now training them in what is called the psychological first aid, which is a standardized way of offering care in cases like this, so that everybody is offering the same thing, which is WHO approved, which is international, and there is evidence that it works when there are problems like this.
Okay, I understand it is easier to work with these cases, let's say in an institution like the quarantine centers and stuff, but what is happening at the household level? We have case number 25, which happens to be maybe Abigirl, will be self-isolating at home. What happens? Is there any psychological support for me, for my mother, for my father, for the family, as they take care of me, and also for me? I'm in a room, I'm being isolated from everyone else. Is there something that is being done for my psychological well-being?
True. What we have actually done is that we have actually gone virtual in terms of offering those kind of services. So if you go even on Facebook right now, we actually created a Facebook page called Sound Mind ZIM. And what we've put in there is recorded psychological tips and what to do by Zimbabweans, for Zimbabweans, in all the vernaculars, English, Shona, Ndebele, and we are looking for people who can actually translate the information into more language so that we can have the spread. What we've actually noticed is that the price of data or data bundles, they're sort of like hampered, our reach. And so we are looking and say, what can we do? But what we've also done is we've set up toll-free numbers. And as we speak, at the crisis center at Paranyato, we have found funding to set up a dedicated psychological call center, which is going to be free, and we have got in volunteers already who are willing to work 24 hours. So a lot is being done. Were we prepared? No. Are we preparing? Yes.
A report released yesterday by the Zimbabwe Association for Doctors for Human Rights yesterday states that Zimbabwe's COVID-19 management competences far fall below WHO standards. Is this true?
Well, I don't know what they mean by that, which WHO standards they are talking about, but I do know WHO looks at various levels, various areas, and they can rate you in those. And for Zimbabwe, as Dr. Chirisa said earlier on, of course when this thing came in, we were not ready, but we have been running like mad, preparing. Remember, our health system had been really in the doldrums, if you like, struggling, lots of issues, whether you're talking HR, strikes, and all the equipment and so on. So when this hit us, we really were running from way below zero, if you like. And we've made lots of progress in terms of preparedness. Again, we're now looking at those 6 areas that I mentioned earlier. We want to make sure that if we're looking at preparedness for COVID, have we put in place the isolation facilities? Where are we with those? We've identified a number of them, but for each and every one of them, we still have a lot more work to do. When we started, we had Wilkins Hospital, for example, here in Harare, and it was nowhere near what we required for the severe critical cases. Remember, it was just an isolation facility. It didn't have ICU. But if you go there now, it's now a state of the art with ICU ready to admit. That is preparedness. We don't have every single facility throughout Zimbabwe. No, it can never be, because we'll never have the resource to have every single facility. But we're strategically moving forward, prioritizing, and so on and so on. If you're looking at the quarantine facilities at ports of entry, we started with very few. The masses that continue coming up, we are so stretched, and we continue identifying new. We have even robbed in the private sector. You can have your facilities designated as quarantine facilities. The healthcare teams go and assess, and we use them. So that's preparedness, if you like. So at every single step, if you're looking at laboratories, we used to only do PCR at Harare Sale Mugabe Central Hospital. But as we speak, once again, we robbed in the private sector, government realizing that we can't do this alone. We're not quite prepared. What is it that we need to do? Here comes the private sector, the Lancers, the ZIMAs, and so on, and they're running with us together. That is what I call preparedness. Not quite where we want, but we have made so much progress. And so it depends on where you're looking at. Some would like to call it half empty, others would like to say half full. The fact is we started at empty. We know where we are, and we continue moving.
Still on that question, Dr. Chirisa, as the Zimbabwe Medical Association, ZIMA's SG, is Zimbabwe blindly dealing with COVID-19?
Well, that's a very important question. Thank you. What we feel is that when the pandemic reached our shores, we were quickly involved. In fact, a task force was actually asked to come from ZIMA. And the task force that is actually running most of the pillars that is to do with especially case management are actually affiliates of ZIMA, the anesthetists, the physicians, the pediatricians. So we've got this input from all the affiliate associations, and we are looking at their expertise and experiences from elsewhere, where we are continuously having dialogue with what is happening with other doctors, like in because we've got so many Zimbabweans that are working in hotspots in New York, in the UK, with Zimbabweans in Australia. So we are having dialogue and say, what's happening there? What can we do here at home? So we are having this inter-exchange of information, and it's helping us in order to prepare and also to direct policy. Now, for example, even the use of masks that we are doing, it was a recommendation from the Zimbabwe Medical Association after we have seen that it will decrease the rate of transmission in the community. Is it the best? No. But will it work? Yes. Are you hearing? So what we are doing is that we are looking at our low resource setup and say what can be done with the resources that we have. As you can see, every country is running and they are focusing on their own. And we also have to focus on their own and say, what can we do for ourselves? Yes, there are handouts that will come, help that will come from here and there. It's all welcome. But also is what can Zimbabweans, as Zimbabwean doctors, what can we do for our own? So what you are seeing on the ground is actually being done by the medical practitioners in this nation as we prepare to take care of our own people. And yes, we are not at where we would want to be. But definitely we are better than when we started, and we will continue to thrive. So every day there are meetings which are happening, a lot of work, a lot of organization, a lot of changes, because this is a changing pandemic. At first we had one unit, and now we've got a unit in every province. Now we've got a unit in every district, which are more than 54 districts. Now we've got private, and all those are being manned, and they need guidance from the medical practitioner, and that is being done.
So at this juncture, can we say, with the cases that we have at 51, are we managing as a country?
We are grateful to God that the cases are still at 51. The models that we had used, we're actually expecting that by now we'll be in the hundreds. So by God's grace, we've got this 51, and we have not seen a lot of them needing ICU. But still, we are not going to let go the pedal on, and we are just going to prepare for the worst case scenario. We are hoping for the best case scenario, but we are preparing for the worst case scenario. So every hospital right now is preparing. What if there's a patient that comes in that needs ICU? So that is being sorted. What if there's a patient that needs these drugs? That's being sorted. So there's a lot of logistics which are actually happening, and it's being coordinated by the medical fraternity and by ZIMA members, because these are your PMDs, these are the people that are actually the clinical directors in all the hospitals. So there's a lot of work that is being done, preparing for the worst case scenario. But we pray that we will not get there. But also one of the things that has happened is that we have actually improved the health systems generally. And even after the COVID, we'll have better infrastructure, we'll be better prepared even for the next epidemic.
Coming to you, Dr. Mahomva, there is a headline in one of the local newspapers today that is saying COVID-19 bombshell, Zim test kits run out. Have you run out of test kits?
That is not true. Remember, we do screening using rapid test kits. Those are the ones that we use at ports of entry and so on. And if someone tests positive with that, they're going to have the diagnostic test using a PCR. And when we started doing the diagnostic test using the PCRs, it was just the National Microbiology Reference Lab at Saleh Mugabe Central Hospital. But we've since expanded. Remember, we talked about gene expert machines, which are in every single district that could use special cartridges to do PCR testing. And I'm happy to say we got the initial 300, we used them for training and so on, and we recently got an additional number for gene experts. So we're using those. We might have run out of the PCR, the traditional, but we're still running PCR testing using gene expert machines. So some of that message that comes out in social media and so on, you need to take it with a grain of salt, because they're looking at one angle and not looking at the other side. Remember, these test kits are in short supply throughout the globe. So as Zimbabwe, we're being very strategic and saying, what can we use? Let's go for the gene expert. Let's go for the traditional PCR. Let's also continue screening at ports of entry using rapids. And we keep moving. We've ordered some more. We're, of course, also getting donations from well-wishers, the UN, the WHO, CDC Africa, you name it. We don't have the amounts that we want. That we can never run away from that, and we'll never pretend that we have enough. And this is one of the reasons why we have not been able to test as many as we would like. But we are prioritizing and ensuring that for the positive cases, for example, that are coming, we've got kits to test their contacts. For those who've got symptoms and so on, this is one of the reasons why even in the workplaces, there was that directive to say, actually, make sure you're doing risk approach in terms of testing. Check your temperature, check the symptoms. If one has got all those, then you go for the PCR. Otherwise, they're allowed to come to work anyway, while you continue getting kits and so on to do the test for everybody. It's specifically saying to us, we are a resource limited setup. We have this finite small resource. How can we prioritize? What is it that we can do? So some would choose to look at it the opposite and say, oh, there's nothing, we don't have PCR, we don't have this. That's their view, but we are saying, let's remain focused. Let's use what we have in the right way, in the right place, at the right time. We will make it.
Then the same article is also going on to say that there is a huge backlog of thousands of untested laboratory samples countrywide. Is this true? So now can we trust the number that we have at 51?
We did have some backlog here and there. If you remember, in one of the daily updates that we actually issued when I was still in my old job, we made no secret of the fact that the Blawayele, for example, had temporarily stopped because there were some consumables we had not been able to get. And then once we got them, the teams worked flat out, 24-hour shifts to clear that. So every now and again, because of the limitations of the test kits, the consumables that we get, we'll have glitches here and there. We will never ever run away from actually saying it, Those are the challenges. But the most important thing is when we get a challenge, we figure out how to address it and we keep running. We will never look back. And yes, we are making progress. We might want to be there. We are here. We came from there. We're making progress and we're not going back.
Dr. Chirisa, on the issue of protective clothing, where do we stand as of now?
Okay, thank you. That's really a hot issue, especially with the health frontline workers. I've been, obviously the amount of PPE that is needed is a lot, because this is something that you use on a daily basis. However, I'm happy to say that a lot of organizations have come in. We've seen OK or Mutual, Net One, a lot of people donating, PPEs. Are they enough? They are not yet, because the need is so great. Every hospital needs PPE. Even some of the surgeries, private surgeries, they need PPE. And so we have to we then actually came up with and we are using WHO guidelines on the type of PPE based on risk. So those who are working in higher risk will need the full PPE with the gown, with the shield and the N95 mask. We have then said those who are working at least they can use the surgical mask. Those who so there's a stratification so as to preserve the PPE to where it is needed the most, because we have the person with the least need having the full gear, and it's a waste given the kind of resources that we have. So there is a global shortage of PPE, even in resource-rich countries. Yeah. We have seen this in the UK, we've seen this in America, and we are not spared. But what we are saying is that the level of PPE that is we still need more input into the PPE. It will give comfort to the doctors, it will give comfort to the frontline, to the nurses that are working. But obviously it's going to be prioritization in the high-risk areas, especially the COVID centers are the ones that must have the PPE the most. The rest, we need to continue to do the general guidelines, the temperature, the sanitization, the wearing of masks. That will help us, and that's the message that we want to get to people, is doing those things will then help us save lives, because we don't have the resources for every doctor, for every nurse, for every orderly to be wearing a full gear every day. It's not practical given the current settings, and we do not produce most of the components. These masks are not produced in Zimbabwe, they are imported and things like that. So we don't have our own capacity. So it has also helped us to say, look, we need to invest in our own capacities in order to take care of our own needs, especially on some of these surgical needs. But yes, PPE is still a challenge. Yes, more, some has come in, more is still coming in, but we still need more.
Looking at the theme for this year, kindness, what does it mean, especially in this COVID year? I'm
so happy that this is the Mental Health Awareness Week, and the theme is kindness. And what we are saying is that people need to be kind. Somebody who has suffered, somebody who has had, does not need more trauma from friends, from neighbors, but we need to express our kindness. We need to express our, that have that human touch. Being good, consoling that person, because that person has already gone through a lot, being tested, waiting for the result, not knowing whether you're going to deteriorate, whether you're going to recover, whether you're going to die. It's so traumatic, and it is not good for then us, the people that are around, relatives, friends, and people in the neighborhood, workmates, then to add on top of that stress. So that's why we are saying, let's be kind to one another. Let's bring that humanity, because everybody, tomorrow it can be you, tomorrow it can be me. So we need to treat each other with kindness, and that is very key to maintain mental health. And also what has been seen is that if you as an individual are kind to another, it also protects your own mental health. That's why you see that when you do something which is positive, when you give somebody, you actually feel good. When you volunteer your services, you actually feel good. Because it actually protects, because there are endorphins that are released in your brain that make you feel good, and that protects you as an individual. So acts of kindness will protect you, the one who is providing the kindness, and will protect that one who is also the recipient of the kindness. So let's be kind.
From the 18th to the 24th of May is the Mental Health Awareness Week, and today we had a psychiatrist, Dr. Secretary Chirisa, who is also the Zimbabwe Association, ZIMA Secretary General. The theme for this year, it is kindness. It is kindness. Let us be kind to people out there as we move around. Let us always be kind. Let's practice what we want to. Thank you for watching.